Welcome to Integrity Linguistics Institute. Right. So now let's take a look into the third question. So again, this question is coming from the actual question paper. The question is, some patients feel that their missing limb is still attached, but, okay. Now you see over here, this is something that is extremely important. The word but over here. Okay. So the word but is what we call as a contrast marker. Okay, what is the word but? It is basically a contrast marker. So the most common word is but, and then there are other words like although, even though. Okay, however. Okay, so again, these are also contrast markers. So contrast, white and black, they are contrasting colors. Green and red, they are contrasting colors, right? Means opposite. Contrast basically means opposite, right? White, black, green, red. Okay, so contrast over basically here means there is a positive information and then there is a negative information. Okay, so what does contrast markers do? So contrast markers, what they do is they signal, okay, they signal a sudden shift in idea or message. This is what they do. Okay, now see over here, some patients feel that their missing limb is still attached. Okay, so what is the information over here? Some patients, okay, there are some patients, they feel that the missing limb is still attached. So we can say, okay, the patients, they are feeling. So actually it is, so we can say it is a negative, it is like, it is one particular information. Okay, so we can say it is a little bit of a negative information, we can say. Again, negative information. Now, without a full stop, without ending the sentence, the word but is coming. Now, what they're going to do, what does the word but do? So, but is a contrast marker, right? So, it signals a sudden shift in idea, right? It signals like a sudden shift in idea. So, from negative, it is going to be a positive information. Okay, so this, again, the more practice you do, the more clear it becomes. So right now, I'm just giving a very small idea. It's actually a very, very big topic. So this contrast marker is a very big topic. Right now, I'm just giving a very small introduction regarding this. So basically, you just need to understand that there are some words that signals us in. That is, the speaker over here is suddenly shifting. The speaker is suddenly shifting the idea over here, suddenly shifting the message. So it usually comes with a signal like although, even though, but, and all. And if you come across these words, you can understand there will be two contrasting information coming. Right. So like that. So over here, the question is asking you that some patients feel that their missing limb is still attached, but, okay, and we have A, B, and C. Okay. But would cause pain if they used it, is fixed in a strange position and has increased in size. Okay, so we have something regarding their size. We're talking about their position in which it is fixed and also how they are using it. Okay, see, it is actually impossible to use their missing limb. Okay, and that is the mixing, like it is impossible for a missing limb to be in a strange position, and also it is impossible for a missing limb to increase in size. There is no limb there. So if there is no limb, how can it increase? How can they use it? How can they say it is in a fixed position? Okay, but it is a feeling. Okay, it is not there, but it is basically a feeling. Okay, so the feel that the missing limb is still attached to their body. Okay, but even so, that is one feeling. Okay, so that is one feeling. Now along with that, a completely different feeling. Okay, they are saying. Okay, so that is what we need to identify. Right. So anyway, what question type is this and what should you listen for? So what should you, so now you have understood the question. Now when the audio is going to play, what should you listen for from the audio? Should you listen for the patient's emotional reaction? Should you listen to the patient's physical sensation or description? Should you listen for an expert opinion or should you listen for a treatment outcome? So this one is slightly tricky. So is it A, B, C, or D? What should you listen for? What kind of question is this? What should you listen for? Emotions from the patient, emotional reaction, physical sensation, opinion, and treatment. Again, everyone participate. Only if you participate, you can understand how to improve. Does not matter if it is right or wrong. That is pointless. During the preparation phase, you have to be a good student is always happy to make mistakes. You should be very, very comfortable to make mistakes, because mistakes are the one of the greatest teachers in life. They reveal. So only Jyoti here is willing to improve, is it? No one else. What type of question is this? What should you listen for? I'll give you 5 seconds more. Is it A, B, C, or D? No one? All right. So we have two people going with answer option A. All right. So now, actually, the answer option is B. All right. Physical sensation is what we have to give importance to. All right. Physical sensation or description. I'll tell you why. Now, you see, the patient's feeling. Okay. Now, the patient is feeling something. Okay. Now, what is this feeling? It is not an emotional feeling. The patients feel that the missing limb is attached. So what type of feeling is it? It is a physical feeling, right? If, see, for example, if I'm wearing this watch is attached to my body. So it is a physical sensation I'm feeling. It is not an emotional sensation, a reaction over here. So here, the missing limb is attached to the patient's body, right? So that is a feeling over here. All right. Now, A, B, and C. Now, as I told you, but is a contrast marker. That is a signal change will be there, but it is related still to the feeling, the physical sensation, right? So here the question is asking you, the patient is feeling that the missing limb is attached. Okay, but what about it? Okay, so here you have again, see, would cause if they use it. Okay, see, pain is also what? A physical sensation. Okay, fixed in a strange position. Okay, that is, it is attached in a frame position, and also it has increased in size. So these are all what we can say as physical sensation, means feelings that the patient experiences, or the patient is describing how it is how the missing limb is feeling in their body. So you should know, okay, so here the patient is feeling that the limb which is not there is there in their body. So how are they feeling? What is the physical feeling they are experiencing? How is the patient describing that physical feeling? So here I have to listen to the physical sensation coming from the patient's body, not an emotional reaction, not the opinion. So they are not asking you the opinion of this doctor. They're not talking about the treatment. Everything is this. So see, if you have this attention, if you have this focus, then when listening to the audio, it becomes easy, right? So this is why comprehension of the question is extremely important, right? So now let's take a look into, okay, so here is a patient's physical sensation or description. So here you have to focus on how the patients describe their phantom limb. So how the patient is describing. So listen for strange feelings, body positions, imagined movements. Be allowed for sensory words like angle, stuck, shrunk. Okay, so these are some words, okay, sensory words. That is words that expresses feelings or sensations. So you have to, again, that this is how you have to mentally prepare yourself, right?